So are screening programs good, or are they a source of false promises and false hope? Welcome to HEALTHdrum. I'm Dr. Bert Vorstman, a urological surgeon and former researcher, and this channel is all about sorting medical fact from medical fiction. HEALTHdrum provides material for educational and informational purposes only and is not a substitute for professional medical advice. The links to the disclaimer and the material in this video are in the description below. And if you like fact-based healthcare information, please hit the subscribe button for me. Okay, so let's get into it. So what are medical screening programs? Medical screening programs focus on testing for several important health issues. They check asymptomatic patients for early signs of certain diseases. The screening tests are not diagnostic. They may assist as preventative measures, and they can also assist in risk assessment of certain health conditions. So what are the potential benefits of medical screening programs? So there are several benefits of good medical screening programs. They may lead to the detection of early signs of disease, and if treatment is needed, a less invasive treatment may be successful, and the treatment may be more effective if undertaken earlier in the disease's natural history. And there may be an improvement in long-term health after successful treatment. As well, successful screening may reduce the risk of disease complications. So in general, screening for certain diseases may prevent the development of a more significant disease if the disease is detected early enough. So what are the potential downsides of medical screening programs? Every test or treatment has possible downsides, and with screening programs, they include false positives, false negatives, testing complications, and psychological stress and anxiety during testing and repeat testing, time wasting, inconvenience, and costs, as well as the risk of overtreatment of diseases that you can outlive without significant impact on your daily activities. So what makes a good screening program? So this screenshot lists the criteria necessary for a screening test to be useful. The test should be highly sensitive, highly specific, very reliable, safe, and affordable. However, most screening tests don't meet all of these important criteria for being useful. In fact, many screening tests only meet one or two of these criteria. So if you're scheduled for a screening test, is there anything that you should avoid before the screening test? Many screening tests have things that you should avoid before the test. For example, many blood tests require that you fast, so you shouldn't have any food, coffee, or energy drinks before the test. You should also avoid drugs, alcohol, and smoking, and certain medications like aspirin. Whether or not you need to avoid aspirin before a screening test depends on the type of test being performed and the specific guidelines provided by your healthcare provider. So for stool-based colorectal cancer screening tests such as fecal alcohol blood tests, you may be advised to avoid aspirin and other non-steroidal anti-inflammatory drugs for about 7 days or so before the test. This is because aspirin can cause minor bleeding in the gastrointestinal tract, which could potentially lead to a false positive result on these tests, which aim to detect blood in the stool. However, if you take aspirin daily for heart problems or other conditions, it's crucial not to stop it for the test without checking with your healthcare provider first. They can weigh the risks and benefits and determine the best course of action for your particular situation. You should also avoid strenuous exercise prior to a screening test, as it can affect heart rate and blood pressure and give atypical readings. So who should consider getting a screening test? So screening tests are normally targeted to certain groups of individuals or those with certain risk factors. It depends on the age group, whether the individual is male or female, what the family history is for certain diseases, what lifestyle choices are being made, and what the medical history is for that individual. All of these factors are used to assess the value of a certain screening test in that patient. So what sort of diseases benefit from screening and are supported by strong evidence for saving significant numbers of lives? So here are some diseases where screening is supported by strong evidence for saving significant numbers of lives. Screening for the following diseases: colon cancer, cervical cancer, aortic aneurysm in middle-aged male smokers, high blood pressure, and cholesterol and diabetes. These screening programs have strong support for saving significant numbers of lives. The simplest screening test by far is the one for high blood pressure or hypertension. Early treatment of high blood pressure can prevent strokes, heart disease, and premature deaths. So what about screening tests for inherited risk groups? So there are several inherited cancer risk groups that can benefit from screening. These include those with a family history of breast and ovarian cancer to get screened for the BRCA1 and 2 mutations. Those with hereditary colorectal and endometrial cancer should be screened for the Lynch syndrome. Those with familial polyposis need screening for colorectal cancer. And those with a family history of breast, sarcoma, leukemia, brain, and adrenal tumors should get screened for the Li-Fraumeni syndrome, and those with a family history of thyroid and gastric cancer should be screened for the RET and LDH1 mutations. These are important screening tests for anyone with a family history of any of these cancers, as these tests may be life-saving. Now, what about childhood screening programs? Most sound good, but only a few are supported by strong evidence. There are a few childhood screening tests supported by strong evidence, such as newborn metabolic screening for disorders like congenital hypothyroidism, endocrine for adrenal hyperplasia, hearing tests, newborn pulse oximetry to identify critical congenital heart disease, and vision testing at 3 to 5 years. So what about common screening programs that are not backed by strong evidence? So there are many common screening programs that are not backed by strong evidence for providing significant benefit or saving significant numbers of lives. And they include screening for prostate cancer, whole body CT scans that screen for all sorts of diseases, carotid artery screening, ovarian, pancreatic, and testicular screening, and bladder, oral, and skin cancer screening. None of these programs are backed with strong evidence for great benefits or for saving significant numbers of lives. So for the screening programs that are not backed by strong evidence, why are they still heavily marketed? So the question of whether screening programs are marketed for health or profit is reasonable, since just about every screening test is heavily marketed, whether it's backed by strong evidence or not. The reason for this is that the healthcare system is financially driven. Test makers provide financial incentives to organizations to promote screening. As well, screening programs commonly exploit fear and commonly overpromise and underdeliver. As well, the marketing is usually directed to big groups of low-risk populations and not targeted to specific risk groups. So what are some of the other reasons that the medical industry benefits from screening programs? Unsurprisingly, the medical industry benefits financially from screening programs. Commonly, there's unnecessary testing of low-risk groups. Testing increases patient volume with visits and follow-ups. As well, there's repeat testing because of false positives and false negatives. And there's likely unnecessary treatment of disorders that would never have impacted the patient. As well, all of this testing and screening allows for data collection and the selling of data. So while screening programs can save lives, they can also be used as a tool of medical overreach. So let's drill down on a very common screening program that is without evidence for saving significant numbers of lives. So the PSA test for prostate cancer screening is of unproven benefit, but heavily marketed by the prostate cancer industry. In fact, the PSA test doesn't even meet the criteria for being a useful screening test. It has a false positive rate of about 78%. It's not specific for the prostate or for prostate cancer. Some high-grade prostate cancers produce little or no PSA, so these potentially deadly cancers will go undetected. The limits of 0 to 4 being normal are artificial, made up, and bogus. And urologists' own studies have determined that PSA testing fails to save significant numbers of lives. So these data points for the PSA test make an absolute mockery of prostate cancer awareness programs, which only lead countless men to great harm. Shamefully, despite the knowledge that prostate cancer awareness programs are of unproven benefit, they continue to be heavily funded by the PSA test makers for ongoing deceptive and fear-based marketing. Even more appalling, most prostate cancers are outlived, and there's no irrefutable and reproducible evidence that prostate cancer treatments save significant numbers of lives. I have other videos explaining these details. So what do you need to understand about the benefits and risks of screening tests? So it's important to understand the risks and benefits of screening tests before you undertake them. You need to understand, are you in the right target group? What are the real risks and benefits of this test? How is a test done? What happens if the test is negative or positive? And what's the risk of unnecessary treatment, over-treatments, or no treatment? The material about screening tests should be to empower the individual and not scare and exploit them. So what measures can you undertake to try and stay healthy? So this is a screenshot of healthy lifestyle choices. You need to maintain an ideal body weight, maintain a balanced and healthy diet, get regular amounts of moderate exercise, avoid harmful habits such as smoking, alcohol, and drug abuse, and get adequate amounts of sleep. Additionally, everybody needs to understand how to practice stress management and mental well-being as part of the healthy lifestyle. So let's recap. In this video, are screening programs good? You learned that there are many screening programs available, only some of them are backed by strong evidence, and that healthcare is financially driven. To learn more about routine medical conditions, self-care, and digital health, check out some of these videos, and if you like them, please share them with your friends.